Hi, everyone. So we're just going to wait a couple minutes before starting to get everybody popped on here. We have quite a number of people today that are joining us. All right, everyone, we're going to get started. So it's just a couple minutes past 3 o'clock. Rebecca, you can hear me?
I can.
Perfect. All right, so I want to say thank you first and foremost for everybody that's joining us today on our second day of webinar week here at Kawartha Care. Every single day this week, one of our practitioners, a different number of our practitioners, is going to be presenting on a different topic of choice that you've asked for or that's really prevalent at the clinic. What we've noticed during this pandemic time, where we are probably the most sedentary we've ever been, is a large number of recurrences of different types of conditions. And one of them is going to be the topic that we're talking about today, which is carpal tunnel. So if you do want to register, just as an FYI, for the rest of our seminars this week, they're always at 3 o'clock. They're about a half an hour, always on Zoom. And tomorrow we're going to be talking with Eric about low back pain. Thursday, we're going to be talking with Jillian about hip pain as well as pregnancy hip pain. And Friday, we're going to be talking about how to actually get your posture back in check and fix it. So that will be the remainder of the week, and you can ask us for the link, or you can pop on our social media, so Instagram or Facebook, and you can register there as well. They're all free webinars for you guys this week. So today I'm going to have the pleasure of introducing Rebecca. Rebecca is a massage therapist here at Kawartha Care. She's been with us for 5 or 6 years almost now, and she's been a registered massage therapist for 20 years. We had the pleasure of working together right from the beginning, Rebecca and myself, and I would say she's one of the most compassionate people that I've had, again, the pleasure of working with. She, in the last 5 years, has seen, I think, over 3,000 patients here at the clinic for a variety of different concerns. And without further ado, I am going to introduce Rebecca and our topic today, which is carpal tunnel. And one last point is, if you do have any questions, we are going to be answering them at the end of the seminar. So you can pop on to the bottom of your screen and you can write your questions in the Q&A and we will answer them at the end. And of course, if you want to chat or have any other concerns throughout, you can go to the chat box and you can type in there as well. So again, without further ado, here's Rebecca and our topic, carpal tunnel.
Well, hello there. Thank you for joining me today. This is wonderful. I hear that there's many of you that signed up, which is just amazing. So thank you again. So as you've heard, the topic today is carpal tunnel. And I am so excited to be talking about this because not only is it because everyone's at home these days, working from home or whatever, but I also have a personal story to share with you in a little bit. So the agenda for today is quite lengthy, so please bear with me as we go through them. I'm going to try and make this as fun and as interactive as possible. So just sit back, relax. If you have your drink with you, that's great. But I will ask you, if you can, right now, while I'm going through the agenda, if you want to run and grab a soup can, and if you have a ball laying around, even if it's a dog's ball, make sure it's clean, haha. Because this is where you're going to be joining in on the fun. So I'll just give you a minute right now when I'm going through the agenda. repetitive strain injuries, and I'm going to be talking about each one for a little bit. Pathophysiology, anatomy, the pathway, the symptoms, the risk factors, the testing, the treatments, the exercises, and the prevention. And the exercises is what you guys will likely really get a lot out of. This is where the interactive part comes from, and the prevention. And then we'll just close, and then as Dr. Azir said, there's questions and answers. You can click on the bottom of your screen and type your questions in there, and they'll be answered for you. All right, so thank you. So without further ado, we're going to get into it. So first of all, carpal tunnel, along with tennis elbow or lateral epicondylitis, they fall under the category of repetitive strain injuries. So I'm just going to touch briefly because carpal tunnel is a repetitive strain. And that's from anything from computer workers, working on your devices of any means, construction workers operating heavy equipment or using a jackhammer. To what I did is I was a dishwasher mom, just anything that's repetitive strain. Even me, what I do as a living in massage therapy, that's repetitive strain. So repetitive strain is just basically, it's just a gradual buildup of damage to the muscles, tendons, and nerves from repetitive movements. The most common types, as I've already said, is carpal tunnel, what we're talking about, and the tennis elbow. And the pathophysiology is just basically, it's just a big word talking about the compression of the median nerve on the hand. Can everybody see that? And you can see there's a picture in the bottom right. There's the cross section of the median nerve shown there where it's compressed. That's the red area that you see. And then the hand below is showing like where the median nerve is. And it's just pressing of structures that decrease the space in the wrist. Because the median nerve is the main nerve in the front of the forearm. And as a result of load exceeds capacity, which basically the body can just not handle any more pressure than what it can handle. So in that picture, before we move on, we'll go back to the other slide. You can see the carpal ligament, the median nerve right there in the yellow, and then that makes up the carpal tunnel. All right, next slide. Now the anatomy. Okay, this is termed the laborer's nerve. So being because, you know, of our movements with our keyboard, our hands and wrists on the keyboard, and just always do it like if you do the jackhammer, you can just see how that would be the laborer's nerve. So anyway, that's the median nerve. And it's composed of the wrist, the hand, the palm, the first 3 digits, and the half of the fourth finger. So the thumb, the next finger, the middle finger, and half of the fourth finger. And as well as the tendons in the forearm, which the forearm is anything below the elbow, right to the hand. That flex the hand, as well as the transverse carpal ligament, which is in this area of the hand. Can you see that okay? And then as you see in the bottom right, below the wording, there's a picture of 2 arms showing the median nerve, which is the yellow one there, running right down the middle of the hand, of the arm. And then right beside it is the ulnar nerve running down by the baby finger. And then the other side is the radial nerve. Now there's a pathway that this median nerve travels. And it starts at the neck. I don't know if you can see me right here. It's kind of hard to see because of my shirt. But there's 7 discs in the neck. And the 6th one is where the median nerve starts. It starts at the C6 and comes down the shoulder, all the way down to the elbow, through the elbow to this forearm, and to the affected digits that the carpal tunnel affects. The thumb, the second finger, the middle finger, and half of the 4th digit. And this is amazing. It's so easy to understand how carpal tunnel can happen because there's only a small space, and that's a 1-inch pathway that's formed by the hands and bones and the transverse carpal ligament. And then over top of all that is a piece of tissue called the flexor retinaculum. And that's a covering to keep everything in place. It's like a supportive network, so nothing falls out, so to speak. And also, too, here's a little fun fact. No real reason, but it's more common in women. Well, we know that, right? Because women are hardworking more than men. Ha ha. Now,
I agree with you, Rebecca.
Pardon?
I agree with you.
Yeah, that's right. So we're going to talk about the symptoms now, and this is where my story is going to come into here. And you see the top one is pain, and it's more prevalent at night when you're trying to sleep, and then you can't because of this whole horrible pain, numbness, tingling, decreased sensation in the palm and those first few fingers and the half of the fourth one, loss of muscle or atrophy, which is that muscle wasting in the thumb and the muscles that control abduction, which is moving away from the hand. Can you see it there? Weakness and motor function. And what I mean by motor function is like grip strength, like holding on to a soup can, like, okay, because I've already had carpal tunnel, so we're going to get to that in a minute. If I had carpal tunnel right now, and I'm holding the soup can wouldn't be able to stay in my hand because I just don't have the strength to grip it. Or even holding a ball, there's no way I can squeeze that ball like that. Now, my personal story is with all these symptoms that I'm showing here is I was 19 and I was a dishwasher in a restaurant. And there's just one day I was working there, and next you know, I had at that time the dinner place. This was a fine dining restaurant. The dinner place at that time was $12 a plate, and it was in my hand. Next you know, it's on the floor in pieces. And I go, what? I had, like, my experiences, I had none of the other symptoms. I had no pain, I had no tingling, no decreased sensation or anything. I had no redness, swelling, or inflammation. I just had no feeling at all. I was completely numb. In fact, when I went to the specialist, like the neurologist, the neurosurgeon, he couldn't believe it when he did this test on me called the nerve conduction test. I had no reaction. And my carpal tunnel was in both hands. It's not always that way. It can be one hand or the other one, but it can be in both hands. So that's my story. And unfortunately, or fortunately, depending on how you look at it, I had surgery because we didn't know of any other treatment options at the time, like massage therapy or chiro or physio or anything else like that. But anyway, moving on. Now, we have some risk factors, and they're obesity and diabetes. And why they are the top two is because just like the pregnancy one we're going to get to, there's a lot of extra fluid buildup in the body, and that's putting a lot more stress on the limbs and on that median nerve, as well as the tight muscles. And so, of course, you can understand why that space would get decreased usually fast because it's only small, right? So, of course, the fluid buildup in there, that's going to create some of the swelling and, of course, leading to the other symptoms that we talked about. Then arthritis, pregnancy, fluid changes, which normally disappear after pregnancy. I have that as well. And a fracture of the wrist known as a Colles fracture. And then there's a couple of rare medical conditions that I found when I was doing my research on this, and we're not going to touch a whole lot on that. I'm just putting it up here just to let you know that there are a couple of rare ones. One is called acromegaly, and it's a condition from too much growth hormone. You've probably seen people who are like gigantic in height. Well, who knows? Maybe that's what they've got. I don't know. And then another one is myxedema, which is advanced hypothyroidism to do with the thyroid gland. Okay, now this is the interactive part. So get your hands ready. Ready? All right, so there's a few tests that we're going to do here. And these tests are what the therapist would use to determine the possibility of carpal tunnel when you come into the clinic. And the first test is the phalanx test. And all these tests that I'm going to be talking about and getting you to are all going to be to reproduce symptoms of the carpal tunnel. So I want you to first put the back of your hands together with your fingers down and just hold your hands back of your hands together like that for 1 to 2 minutes, and then just release. This is called inflection. And if you are having carpal tunnel right now or having some symptoms of it, then with this test and all the other ones, you will probably feel some tingling or even some pain going into your fingers, the palm, and maybe up your arm a little bit. And then you just release it. And then there's a variation of this one, which is what was done on me, because I had both these tests done. when I went through mine is we had this one, but you just flip your hands up. Everybody do that? It's if you're swatting a flyway. And the same thing, if you're getting some tingling into those areas, then that's quite indicative that maybe there is some carpal tunnel or something going on. We don't know that.
Rebecca, were any of these tests positive when you had carpal
Yes,
tunnel?
well, like I said, I had no tingling or anything. I just had complete numbness. So, and that is one of the symptoms. So because I didn't have any feeling and it was all numb, then mine was definitely carpal tunnel. And testing 2, and now I don't remember all the tests that were done to me. I just remember the first one. But anyway, this is the Tinel sign, and what it is it is reproducing pain in the distribution of the median nerve. So if you take your hand, like I have here, and where that median nerve is, if you take a couple of fingers, and you put it over that median nerve, and you just tap the area, and if you're getting tingling like I am, this is another sign that possibly you have it. And this would be over the volar ligament.
So just right in the middle.
Yeah, just kind of like to the side or just almost in the middle of the wrist. Can you see that there? Okay, and then range of motion testing at the clinic is what we also test for testing for decreased range and restrictions in the muscles and muscle spasms, and also gripping for assessing for the grip sake, like we did earlier with the soup can and the ball. And then there's another test we called the Jeffrey Aikens test, and this is to mimic occupationally induced carpal tunnel syndrome. So just like we did the Phelan's, is we're going to hold our hands, the back of the hands together, and we're just going to gently bounce our hands together. And the same thing, if you get any of those symptoms we were talking about, the tingling, the numbness, or even possibly pain, and that's probably a sign that there's some carpal tunnel going on there, but we don't know that for sure. Now, lastly, we do a nerve conduction test, which we don't do, but the specialist does that. Now, treatments. Okay, we're going to talk about massage, and this is where we come in at the clinic. When you come in for a massage and you do have carpal tunnel or possibility of carpal tunnel or even prevention of carpal tunnel, we can treat the whole body, but with focus to the neck, the shoulders, the arms, the wrists, and the hands. And the reason why we do the neck and the shoulders is because of us being at our computers or construction workers, we're not in a good posture when we're working. I mean, here we are, our hands, especially if we're not at a screen face on, then our necks are forced into a downward position more, and then our shoulders get up to our ears, right? And so, of course, the massage is going to help release some of that muscle tension that's in the neck and the shoulders, as well as in the arms and the wrists and the hands. And what it's doing is it addresses the inflammation and pain and the numbness by softening and lengthening the muscles and the fascia of the neck. Now, the fascia is a connective tissue structure that holds everything together in the body. Okay? In the shoulder, the upper arm, the elbow, the forearm, the wrist, and the hand. And also, too, along with massage therapy, physiotherapy and chiropractic can help with carpal tunnel as well. And what happens is they would do a full assessment and determine if there's any specific treatments in addition to the massage to help control carpal tunnel and their symptoms. The frequency of symptoms, okay, now depends on the stage of the game that you're in. If you're having the redness, the inflammation, and the swelling, well, that's the acute stage. And that's where, when you come in to see us, we would want to see you on a more frequent basis, because the acute stage lasts between 1 to 3 weeks with pain and some of the other symptoms. So we recommend 1 to 2 treatments per week at 60-minute sessions for 4 weeks. So that's 1 or 2 sessions every week. And then after that, if you're doing better, then it becomes a chronic stage, which is greater than 4 weeks of pain. Then we would have you come in and, a treatment a month along with the regular self-care regimen, what we would send you home with, of exercise, moist or cold, if inflammation or swelling are present, a self-massage, which we would send home with you to the affected area. And you can treat we would treat both sides, but mainly we would focus on the affected side if you're only having symptoms in the one side. Okay, now this is a part I know you've all been waiting for, are the exercises. And before we get into them, because we've got quite a few here, and I'm going to this is interactive, so get ready, get those hands ready. As all stretches, what we recommend are to be held for 15 to 30 seconds and to be done 1 to 2 times a day. Twice a day if you can, but if you can't manage twice a day, once a day is fine. And if you're having any symptoms, inflammation, or swelling after the exercises, then we recommend you apply some cold to it, otherwise moist heat. So what we're going to do is, if you see at the screen, we've got several exercises there, and we're going to start with the range of motion exercises where you see A, B, and C. So on the top left there is that the range. And I'm going to stand up and do these. Well, let's try sitting down and see how we go. Let me know if you can see it. Can you see that? Manju,
you want to come a little closer to the screen or to the camera? Perfect.
All right, so we're just going to hold our hand like that, as if you're going to be picking up some pins off the table. I don't want you doing the motion. I just want you to hold that so that your thumb is pointing onto your fingers. And then we bring our hand back with our fingers curled. Can you see that?
That's perfect.
And then hold it. And then the other exercise I'm going to do with my other hand, you're going to hold your hand so that your thumb is right here. And you're going to turn your hand in the motion like as if you're rocking, as if you're fishing, holding the fishing pole and you're bobbing. And now we're going to move down to the next set called the wrist stretch. And you've probably all seen this one, but we're going to all do this together. We're going to hold our hand down with the fingers in the downward position. We're going to take our arm and hand, place it over the palm so that your fingers are resting on the baby finger. And we're just going to put some pressure. We're just going to stretch that wrist so that you're stretching the wrist extensors. And then we're going to do the other way. We're going to place our hand like this, and this is for the wrist flexors on here. And we're just going to bring our hand back. Can you see that?
Perfect.
Okay, great. Now, you see the next slide down, our tendon glides. I have a separate sheet for them because I don't really like this one here. And all these exercises are going to be stretching the muscles out in the forearm to release that pressure off the median nerve, to keep those muscles lengthened.
We will be sending you the presentation once it's done, so you don't have to memorize these or take too many notes if you don't want to right now.
Great. So now we're going to get into, right beside the tendon glides, the wrist flexion exercise you see there. So this is where I said you need your soup can and your ball. So we're going to do this with the soup can first. You see that? Can you see this okay? I've got the soup can in my hand here. And just hold like that. And just bring your hand up and down. And they can just hold like here. Well, I'm just going to turn my hand a little bit. We're going to try it like this. We're just going to hold like that. How's that feeling, everybody?
I feel like
even though I said 15 to 30 seconds, I just want you to do all these exercises within your comfort level. If you're having pain,
I feel a good stretch there.
That's good. I'm glad. I feel it too. It's a good exercise. Now we're going to take that soup can again, and we're going to be doing some wrist extension exercises. And instead of, okay, we were holding it this way first. So now we're going to just turn our hand, and we're just going to flip it. And we're just going to hold it like that. And you can go into flexion if you want, or extension. But you don't have to. You can just hold it like that. I can feel that stretch.
Mm-hmm.
Can everybody else? Now, just for demonstration.
If you can feel it, just type a Y in the chat box below.
Now, just for demonstration purposes, we don't have to hold for 15 to 30 seconds. And then we're going to hold the can up like this. Okay. We're almost done here.
Looks like everyone's feeling it, Rebecca. A lot of whys.
Awesome. That's great. Now for the last exercise for grip strengthening, and I just want to add in here too, is when I had my surgery, it took a while for my strength to come back. And so it's not like after you, if we're trying to prevent surgery if we can, but sometimes it's inevitable when it happens. So I'm just going to say building your strength up can take time, even now. So that's just why we're doing this webinar. So hopefully we can prevent anything from happening. So we're just going to take this ball, and I just want you to grip it. I want you to try and squeeze it with your thumb and your fingers. I'm using a tennis ball here. You don't want a really squishy ball because you really want to have some resistance in there. You can do that several times a day. Okay, now we're going to move on to the nerve flossing or nerve glides. It's kind of funny, how they call it nerve flossing. I mean, we floss our teeth, right? Whoever thought we'd be flossing our nerve? But anyway, so there's 6 pictures of these nerve glides. We're just going to go through them starting at number 1 and going down to number 6. So we're going to take our hand and we're going to make a fist. Don't punch your partner or whoever you have with there, or the dog, if the dog's right beside you, even the cat. We're just going to make a fist and we're just going to hold it. Can you see it there, everybody? Type a yes if you can. Then we're going to move on to number 2. So your thumb is right beside your hand like that. Great. I'm glad you can see it. And then we're going to move our hand into extension with our thumb still at our right beside us. And then we're going to move our thumb away from our hand. And then we're going to tip it back a little bit more with our thumb back to parallel with our hand like you see in my right hand. And then what we're going to do is I'm going to switch hands so you can see it hopefully. Is we're going to move the thumb away from the body. Can you see that, everybody? And you can do this the same as the exercises. You can do this as often throughout the day as you want. Okay? And what this is doing is stretching out the median nerve to take the pressure off that space, to keep that space opened up. And also to help prevent any symptoms from happening. Now we come to prevention. And as we've already talked with everybody being at home, working on the computers or the devices, looking at the phones, whatever you're doing, and we know it's impossible, but if you can, for prevention, try to modify your work activity, your job, especially the repetitive tasks. And posture remediation, okay, this is really fun. I don't know how many of you were listening in on the ergonomics webinar yesterday, but anyway, Dr. Azier was talking about ergonomics at the computer. So I'm gonna probably have to stand up for this to show you. So what you want to do is you want to have your computer at eye level down. This will work better. I'll stand up in a minute. What you want to do is at your workstation, you want to have the chair that's at proper height, so it's not too low, not too high, so you're not going to be straining your wrists one way or the other. And you want to have the computer at eye level. So imagine you have an imaginary line coming from your computer right to your eye. And if that line meets the center of your eyes where your pupils are, then you know that your computer is dead on. Okay, so that you're not angling your head one way or the other, straighten that neck, or looking down too far, or even looking way up. Okay, and that's what you want to have. So I'm just going to show you, and also when you're sitting there, you want to have your hands in relation to the keyboard. You want to have them at a 90-degree angle. 90 is from the elbow right down to the hand, just like mine is. Can you see that? That's great.
How many of you are doing that right now while you're at home? You can type that in the chat box as well. If you are, just type a yes, and if not, then type a N for no.
That's great. And also too is another thing too is exercise, stretch and strengthen, what we already went through. And if you are experiencing even slight symptoms, we recommend you see a practitioner to control and prevent injury from coming off full force. And that's the whole point of doing this webinar, is for prevention. Okay, and I'm hoping none of you have this right now. But if you are, please do come and see us when we are open again. In conclusion, okay, we haven't talked about this yet, but recurrence is possible, of course, with the rate of repetitive strain injuries, right? And the repetitive tests that we're doing, what we've already talked about. So take breaks from all devices. And something else I heard from the ergonomic seminar that I really, really liked, it's a 20-20-20. Work for 20 minutes, take a 20-second break, and then look 20 feet away. And that's just to give your body a break, give your mind a break, give your eyes a break, and then just come back to it and work for another 20-20-20. And then do your stretches that we've already talked about, and check your posture that we just went through again. And most important, while you're working, relax, take some slow, deep breaths, and just enjoy it. Because if you're all stiff and tighten up, your shoulders going to come up to your ears again. You're going to look like a hunchback or like this little old lady with no neck. But anyway, massage therapy, physiotherapy, and chiropractic can help in conjunction with one another, because our idea, what we've already said, is we want to prevent the surgical route if possible. And at the end, we do have questions and answers, is what you already know, and type in. And I do see a couple of those questions, so we will get to those and answer them. So I just want to say thank you very much for joining us. You know, and I really miss seeing all of you. I mean, I really enjoy seeing all my clients. It's my passion. And I don't know when we're going to be open again. So I just want to say we're thinking about it and we miss you dearly. And we'll see you again when we are able to. All right. So everybody stay safe and stay well. Thank you.
Thanks, everyone. So just a couple of questions still over here. And for those of you who have to leave, that's okay. We can always send this over later. But just a couple questions, Rebecca, that I'll ask you, or that people are asking. Okay. So during the exercises, should the arm be relaxed or should it be straight and sort of tight?
No, I don't want your arm to be straight and tight, because that's going to make it harder to do the exercise. So relax by all means.
Perfect. And second question, so you guys can still keep typing questions if you'd like, if something's come up. Second question is, are the exercises recommended to prepare for surgery?
It can't hurt to do them to prepare surgery, because anything you can do could help to possibly speed up the recovery phase if indeed surgery is the option for you.
You definitely want to use surgery as your last resort,
yeah, definitely.
Especially because there are so many sort of different practitioners and professions that are able to combat things like carpal tunnel. The thing with surgery, as Rebecca will probably have a little bit more experience with, is despite having surgery, if you're still going back to that repetitive task without changing your workflow, the likelihood of reoccurrence is quite high.
Yeah. But also too, what I want to add is, with recurrence, it's a good idea to have other issues checked out to see if maybe that's something else that's causing those similar symptoms that you had with the carpal tunnel from before. Yeah, it may be carpal tunnel again, but it may be something else, maybe in the neck or the shoulder.
Definitely. And when you have numbness, especially on both hands, and I think you'll agree with this, Rebecca, is often we look a little bit more into the neck itself as well.
That's right.
Because it's quite rare. It's not as common to have symptoms in both. And often it's more so to do with the neck rather than the hands or the carpal tunnel itself that's causing
right.
that.
Yeah. And like me, because my carpal tunnel was in both hands, it was, that was interesting after I had the surgery.
Yeah, for sure.
Couldn't do anything. My hands were bandaged up for 6 weeks.
Yeah.
And like I said again, my grip strength took a long time to come back. I used a ball, but then I used the hand grip weights. Because see, my dad and my brother went through the surgery for carpal tunnel. And so when they say, is there a genetic component to this? Well, some of the research said yes, and some of them said no, but they did say that if you have a family member who had carpal tunnel, then the incidence of getting it is high.
So if there's no other questions at this time, but of course you can always call us, you can email us, and you can go to our website and text us if you'd like. Again, thank you so much for joining us for day 2 of our 5-day webinar series this week. Tomorrow we will be talking a little bit more about an area of concern that's quite popular and a common area of injury as well. I want to say thank you so much to Rebecca for being an amazing panelist and sharing your experience as well. I think it really, because you've unfortunately gone through carpal tunnel, but you've combated it so well, we can really, learn from you as to what you've done to prevent reoccurrence and probably even just how to prevent it from happening in the first place. So thanks so much.
You're welcome. Thank you. And thank you again, everyone.
So just to finish off, as we know right now with COVID, a lot of us are cooped up at home. We wanted to give a little bit of information. So virtual appointments are still available for chiropractic and physiotherapy at the moment. So if you're a new patient, we're more than happy to see you virtually, and we're able to assess and conduct treatments. You definitely don't want to leave the pain and wait for us to open, because you could probably deal with it right now and sort of get rid of it at this point as well. If you are an urgent care patient where your pain is so severe that you're not able to function, that you're thinking about heading to emerge, or you're taking a lot of Tylenol or Advil to combat that, give us a call. We are seeing some urgent care patients, and so we are able to discuss that with you and decide if we need to do that. Another thing to add to this that's not on the slide is that we are doing virtual ergonomic assessments, and that's done by myself as well as Dr. Jillian Edgar, who you'll be hearing from later on this week. And that's actually a Zoom session where we'll be able to look at your space and give you some advice on how to change your work environment so that you are not, maybe pushing yourself too much, and also we're going to help you prevent injury, things like carpal tunnel as well. So touch base with us for any of those types of appointments. And upcoming free webinars. So again, we talked about webinar week. You can register here at that link. You can also go to our social media page, or you've gotten an email because you're a patient of ours or subscribe to our newsletter, and you can sign up. So tomorrow we're talking about low back pain, which is a pain in the butt. And Eric's going to be speaking about that tomorrow at 3 o'clock. It is the #1 most medicated condition, and it's the #1 condition that doctors, MDs, actually see patients for. So we want to make sure that if you are experiencing it, you'll probably get some good relief from that webinar. On Thursday, Dr. Jillian Edgar is going to be speaking about hip pain as well as hip pain during pregnancy. She is dividing it up for those who are pregnant and not pregnant, and that will be really helpful as well. And it's something that we're seeing a lot of here at clinic or getting a lot of calls for. So again, we love hearing from you. We miss you, just like Rebecca had said. We're hoping to see everybody really, really, really soon. But in the meantime, if you have questions or concerns, please feel free to reach out to us at any point. Again, we love hearing your voice. You're not bothering us. And hopefully we will see you later this week for our webinars on low back pain, hip pain, as well as posture. Hope you guys have a good day and take care. Thanks, Rebecca.
You're welcome. Thank you.